Good morning. I'm Andrew Mellin, Chief Medical Information Officer here at Surescripts, and it's great to be here. As I was reflecting on the program today, I thought about it from two different aspects. I'm a physician trained in internal medicine, and the innovations coming out of life sciences are amazing. Diseases that were incurable when I was in my training, like hepatitis C, are now curable. Patients with advanced cancers are living for years longer than they were before. Individuals with severe chronic illnesses are seeing their quality of life dramatically improved. On the flip side, I've been in health IT for over 20 years, and I've spent the past few years studying that journey that a patient takes along the process to get started on their specialty patient medications. And that journey and that process is the most complicated, convoluted, complex process I have ever studied. So today we're going to talk about remapping that journey. Together we're going to try to understand what we can do to improve that, to shorten the time to therapy, to make it easier for everyone involved. What I hope you get today is some ideas, some seeds, some sparks that catalyze this network of individuals who are presenting and who are on this call, who represent every aspect of every touch point along that journey, together how we can make this better. Now, before we get started, I have a few administrative things. First, we are not doing live Q&A today, but we'd love to hear from you. You will see an email on your screen. It's Specialty Symposium at Surescripts.com. Please email us along the day. We'd love to hear your ideas, your thoughts, your questions, your need to connect to others, and we'll answer them, probably not today, but sometime over the next week. So we'd love to hear from you. The second thing is if you have any technical issues, just go back to this home screen, that start screen. You'll see a link to a chat bot. Go there and you can be connected with a live representative. Third, we will be doing live polling during the day. I'd love to hear your voice. We'd love to hear from you. So you can answer those poll questions on your phone through text messages or via a web browser. And last, if you can't make every session today, we will be recording this. We'll be hosting this online in the next week. To kick things off, I'd like to introduce Mike Pritts. Mike is my colleague and Chief Product Officer here at Surescripts, and he will share some opening remarks. Mike?
Thanks, Andrew. Good morning, everyone, and welcome. Thank you, Network Alliance partners, PBMs, manufacturers, and guests for joining us for this Specialty Medication Symposium. I'm Mike Pritts, and I have the privilege of serving as Chief Product Officer here at Surescripts. My wife and I are looking forward to a road trip this weekend to one of our favorite destinations, Charleston, South Carolina. If this were 20 years ago, I'd spend the evening before flipping through an atlas. Remember these things? Coffee stains, torn out pages. Yeah, and piecing together our route. My wife and I would take turns as co-pilots with paper maps strewn across the dashboard. And you know how those conversations go. If this were 10 years ago, I'd go online to find the best route, try to print it out, realize my printer's out of ink, run to the store, and you know the drill, it becomes a whole thing. But it's 2021, and I'm not worried about how to get there. Why? Because I know that we'll just get in the car, tell it where we want to go, and Google Maps will provide the most efficient route. So instead, we get to spend our time thinking about that first glass of red wine and then which fabulous restaurant we'll go to first. Why do I share this story when we're here to talk about specialty medications? Because prescribing specialty medications is like using paper maps. You can't read it, but it says, paper maps are not cool. And sadly, most times, there are no maps at all. These drugs cost, on average, $79,000 per year. And health plans are in the unenviable position of needing to manage this spend efficiently. Specialty medications usually require unique handling, management, patient education, labs, results, follow-ups, and a whole set of administrative processes bogging down the system, trying to get patients on the medication and adherence to their therapy. And the closest we get to automation is faxes, voicemails, and telephone tag. Physicians, pharmacists, and family members are the navigators for patients, and they have no choice but to use these paper maps. That means the journey to getting a patient on their prescription is prolonged, and lots of people are doing extra work that isn't directly related to caring for that patient. Let me share a few data points. Our research shows that prescribers are spending 3 hours per week on paperwork related to specialty medications. And 40% of prescribers say it can take from 1 to 2 weeks to get their patient on a specialty medication once they've written the original prescription. That is unacceptable. Specialty pharmacists report that it takes an average of 4 days to fill a specialty script once it's even received, and wait times of 7 to 10 days are not uncommon. And almost 7 in 10 specialty pharmacists say that administrative tasks routinely interfere with patient care. This all seems to be turning a short trip into a long and arduous journey. I know you can relate to these challenges and would agree that there's got to be a better way. And there is. At Surescripts, we know that technology has the power to simplify complex prescribing processes. We've been in this business of retail prescribing for a long time. In fact, this year, we celebrate 20 years of helping the nation increase patient safety, lower healthcare costs, and ensure quality care. And we're always looking forward to driving even more impact. On this journey, we've immersed ourselves in the specialty market and its unique challenges. And one thing that's clear is that streamlined and automated processes can transform this system and give time back to caregivers while getting patients on therapy sooner. And as with almost every issue we've tackled at Surescripts, we know that real change only happens when we work on these issues together. Today, I am honored to kick off this symposium. We have an incredible slate of speakers. You are in for such a treat today, who are experts in their field, here to share their experiences, highlighting challenges, and most excitingly, presenting possibilities for a better way. In today's keynotes, you'll hear from some amazing healthcare leaders representing 6 perspectives of the specialty medications journey: the patient, the prescriber, life sciences, specialty pharmacy, hub, and health plan. They've each been asked to share their views on these 4 aspects: the journey of getting a patient their specialty medication, the business challenges involved, how they address these challenges, and 4, how they believe technology can play a role in breaking down the barriers. By the end of today's event, I'm confident opportunities to collaborate will emerge. We can do better. We must do better. And we must remove the friction and inefficiencies by automating the specialty prescribing process. Thank you for being here today. There is no better group to tackle this important challenge. We're excited by your presence and sure that you'll be inspired with ideas to solve this important issue. I'll see you again this afternoon in the wrap-up. In the meantime, enjoy the sessions. Back to you, Andrew.
Thank you, Mike. What a great way to start the day. So to start the journey, you have to start with the patient. You have to understand what those challenges are, what's going on in the patient's mind, how they struggle with going from that moment of physician decision, that moment when they're in the exam room and they have a collaborative decision on what to do, to the moment of hope when they start the therapy. That journey is challenging, and as Mike said, we're still on that paper-based map today. So we're real fortunate today to hear about this aspects from someone who can speak both from a national level, representing many patients, and a personal level, representing a story with her family. So I'm thrilled to introduce Steffany Stern. Steffany Stern is the National Multiple Sclerosis Society's Associate Vice President for Advocacy and Policy. Steffany?
Thank you so much for having me. I am Steffany Stern. I'm the Associate Vice President of Advocacy and Policy at the National Multiple Sclerosis Society. I am located in Minneapolis, Minnesota, although the National MS Society is a truly national organization, and we have staff located in almost every single state. My responsibility at the Society is to support activists and staff as they develop and analyze policy positions. I have a focus on state-level policy, but I also have a role in our access to MS medications policy at both the state and federal level. So that's why I've been asked to join you today. I will start by saying that the reality is that today's healthcare system often just doesn't work for the people who need it the most, and I am sure this audience won't be shocked to hear that. If you're not familiar with MS, multiple sclerosis is a chronic disease of the central nervous system affecting the brain and the spinal cord. People with MS typically get their diagnosis between the ages of 20 and 40, which we call those prime of life years, when they make their decisions about their careers and their family, and they're often in prime earning phases. And MS affects each person differently, but the common symptoms that you hear about include severe fatigue, numbness, and also cognitive changes. Most people with MS tend to have to develop strategies to conserve their energy, or they have to develop strategies to make to manage those cognitive changes for the things that are most important to them, like their work and their families. And our current healthcare system really demands a lot of people with MS when they have sometimes limited, precious personal resources that they're using just to get the medications and the care that they need to live their best life. And these challenges within the healthcare system can too often mean that people with MS actually have worse health outcomes. And that affects that person with MS, and it also affects their family, potentially their employer, the health system, and our entire society. People have to self-advocate just to get what they need, or they need a caregiver who's able to dedicate a lot of time and energy to them. And you can see that often translates into hours on the phone, people bouncing between their healthcare provider's office, their health insurer, their specialty pharmacy, the patient assistance program, et cetera, because those entities are just not set up to talk to each other. People with MS have told me that they have a 30-minute lunch break and they spend 45 minutes on hold, and they do that day after day after day. And too often this means that they'll experience a gap in their treatment. And what we know about treating especially relapsing forms of MS is that early treatment and ongoing consistent treatment is the best way to manage the course of the disease and prevent relapses, and then slow down that potential for progression and protect the brain from the damage that a course of MS can cause. So while on the surface it can seem like something's an administrative issue, just a delay of a few days or a week or some amount of time in getting something approved, in reality, it can mean that the person is not able to take their disease-modifying treatment, and then they're vulnerable to a relapse, which can cause damage onto their body. And we worry, of course, that they might not ever fully recover from that. And while I think it can be tough to draw a direct line like that, but we have heard from people with MS about relapses that occur during their medication gaps, which is so harmful for the individual and their family. But it can also mean, hospitalization for several days and rehabilitation, like physical therapy for an extended time to try and help somebody recover from that relapse, which is, costly for them, costly for everyone. I am involved with the MS Society because I'm inspired by my mom, who lives with MS, and she was diagnosed when I was only a year old, and she wanted me to share her story, her recent experience getting access to her medication, because it was a tough one. So my mom was on the same MS disease-modifying therapy from 1998 until this fall. And her MS seemed to be progressing a little bit. She had 2 falls in 2020, one in the summer where she broke her kneecap, unfortunately. And then in November, she fell again and broke her left wrist and her right shoulder. And her doctor finally switched her from a daily injectable to a daily pill. She did a daily shot every day for around 24 years. And she asked many years in a row to get switched to a different med. So even getting that switch felt like a victory, but then that's when the challenges started to kick in. My mom's main MS symptom is that she has debilitating fatigue and she sleeps around 13 or 14 hours a day. And she also has some cognitive effects from her MS. And my dad is her caregiver, basically. She's on Medicare and she and my dad are on a fixed income. My mom is 64, but she is living with a disability, which is why she's on Medicare. But she needs copay assistance to afford her medication. So a change in medication, which she hadn't done in a long time, meant she had to find new copay assistance. So her story really started with calling around to the assistance funds. The MS Society was able to give her 3 numbers to call. Medicare enrollees are, of course, only able to receive assistance from certain kinds of funds, so that's a layer of difficulty. And then when she called around, she discovered all 3 of the funds were out of money, but she was able to enroll to get alerts when they had funding available. And eventually she got a call from a copay fund and they said, sure, we'll fund her, but first we want you to call the drug company to ask them for help, just to make sure that they weren't going to cover it. So she called the drug company, which actually told her, why don't you go back to the copay fund? And she said, I felt like a ping pong ball. And finally, the copay fund said, sure, we will cover your portion of the out-of-pocket. And she felt good about that, and she enrolled with them. But then she next had to engage with a specialty pharmacy. But when she and my dad connected with the specialty pharmacy, nobody would give them a consistent answer about how much they would owe. So they spent a lot of time on the phone with the pharmacy over several calls over several days, trying to figure out how much they would have to pay, because that was so important for them. One of the people they talked to said thousands of dollars, and one said, you're going to owe much lower than that. They called the health plan to figure it out. The health plan was sort of shuffling them around, shuffling to different people. Between the health plan and the specialty pharmacy, they finally confirmed how much they were going to owe, and then they made sure the copay fund was able to pay it. So that part was taken care of, and they thought, surely we're home free, until they connected with the specialty pharmacy to say, ship the medication, and then the specialty pharmacy said, actually, we don't have the prescription from the provider. So I don't really understand what happened here. My dad was a little confused about it too, but they wanted my dad to call the neurologist. So he did that. My dad called the neurologist, but it took a few days for the neuro to call in the prescription. Finally, the prescription was in, but then there was an additional delay because my dad couldn't even figure out what was going on. This is where I think some of the language being used was confusing to him. He thinks it was a prior authorization situation, but he is not sure. And I have no idea whether this was my dad's last step, by the way. I would have started with the health plan, but he had to go his own route. So finally the drug was paid for, copay was paid, everything was approved, and it shipped out. But this process, beginning to end, ended up taking 3 months. And in the end, my mom ended up being off of her med for about 3.5 weeks. And every time a person with MS goes off their med, it's a roll of the dice. This is really an exhausting process, which is made more challenging by the fact that MS can cause fatigue and sometimes cognitive symptoms. And this process looks different on different coverage, of course. My mom's story is just one version of this story. There's a lot of uncertainty throughout the process, a lot of anxiety, and it can be such a tough experience for a person living with a chronic health condition for a lot of reasons. So in this slide, we've got a couple of just other stories to add to what I was describing. So we have nearly 1 million people living with MS in this country, we know now. And for those people, simply getting their disease-modifying treatment can really feel like a full-time job. So here on this slide are the personal experiences of just 2 more of them, in addition to my mom. You can see Michelle, who she was trying to make sure her kids get what they need, but then ended up jeopardizing her own health. And when she talked to us, she said she had been purposefully skipping doses to try to make the medication last longer. And then she was afraid to tell her doctor. And then Eric, I think, sums up the whole burden of navigating the system. So, what are some of the issues that need to be addressed? We do tend to hear a lot about the issues that arise from utilization management requirements. and the fact that all too often it's really challenging for the provider or the individual to even understand why they're getting a denial for their coverage. We sometimes hear that the provider might try to figure out if it's possible to do that, what the utilization management requirements, if there's prior auth or step therapy that's required, and that might even affect their decision making. Even if it's the right medication, they might be deterred by those requirements. A health affairs study that we reference a lot found that physicians and the practice staff spend 20 hours a week per physician interacting with prior authorization requirements, and obviously that's a huge deal for providers. For people with MS, prior authorization and step therapy and copay accumulators and various barriers can be significant challenges, and those are challenging to figure out and to navigate. And we really understand why some of these protocols are put in place by the health plans as a check and benefits. And we definitely acknowledge that the drug costs are very high. And that's why the health plans have made some of these decisions. But for the patients, these processes do have some ramifications. So, for example, step therapy might mean that the person with MS is put on a medication that doesn't work for them because the MS medications are not interchangeable, even though there's over 20 of them now. And then the authorization processes can mean that people face delays in accessing their medication. We also hear a great deal about a lack of information in the office, in the provider's office, or I guess a lot of times it's telehealth now, so in the virtual office. So people don't have a good sense of how hard, or I guess how easy it could be to get their medication, and they don't know how much it could cost them. And a lot of times they just don't have accurate figures about costs in real time at the point of prescribing. And we know that the out-of-pocket cost can mean the difference between a person adhering to their treatment or not. As I talked about it in a lot of detail, we hear a lot about all of the different stakeholders and systems that people with MS have to interact with, and we wish that those could be streamlined. So in effect, if someone, the doctor or someone else on their staff, could be talking to the specialty pharmacy, the insurer, all these stakeholders to deal with paperwork and the process, rather than the burden being almost entirely on the patient to individually call and connect with each one and figure it out. And then finally, it's worth noting that the actual costs of the MS medications have been increasing exponentially, which is why the Society is supportive of greater transparency and accountability from manufacturers around price increases. So how do we as a society work to address these issues and challenges? We work really hard to establish and maintain relationships with all of the stakeholders, everyone in the, within the entire pipeline, everyone who matters to people living with MS when it comes to the world of access to MS medications. We have relationships with the patient assistance program. So, for example, they tell us when they're out of funding. We have open lines of communication with all the manufacturers. We know what shifts are happening in the MS medication space. We're always working to build, more and better relationships with the health plans, specialty pharmacies, and PBMs, et cetera. And we hear in real time from people with MS and from prescribers about what's going on, if they are starting to see a new trend or getting denials for certain meds. Things like that, and then we try to raise those issues with our industry partners directly whenever it's possible to try to find a solution. The MS Society also has a program called MS Navigator that we're very proud of. It's available to help people navigate this really complicated system. Our MS Navigators are very skilled, highly skilled, compassionate professionals who support people as they try to navigate through everything related to MS that's unique to their situation. And they do provide information and education to help people with MS and their support teams to advocate for what they need and when and how they need it. And they also help through the complexities of finding a healthcare provider, understanding benefits, insurance, and access to coverage, and prescription assistance, which I've talked about a lot, is an important component for people with MS. Many of the challenges and barriers that exist apply to all of the disease-modifying treatments for MS, in part because they are very, very expensive. And as you can see on this slide, the real-life impact is that, according to our most recent survey of people living with MS, gauging access to MS medications, 40% reported that they have altered the use of their medication because of high costs. So they're stopping their medication, taking it less frequently, taking expired medication, or even might be on a medication that's not best for them. So what can be done? We think a lot about technology, especially right now at this point in time. If technology solutions can help healthcare providers and people with MS to make better informed decisions, that will help with adherence. So solutions that include information about what the out-of-pocket costs will actually be, then we should be doing that. We also need to talk about providing clarity as much as possible, because at so many points in the process, the patient finds it nearly impossible to even identify what is the hang-up or why is the delay happening. So like with my parents' example, I would ask them, what is the latest status? And often they couldn't even describe it. So they just kept getting confused about who they were talking to, and they weren't always clued in about the right terminology. And these are people who have some level of health literacy, having dealt with my mom's condition for 40 years. So I'm sure a lot of us have been in that situation where we're facing barriers to our care or our prescription, and it suddenly becomes unclear why. And I think technology has a key role to play in these situations. And on a somewhat tangential piece that I love to bring up, there's a difference in types of information and factors that the provider will use if they're an MS specialist versus a community or general neurologist. The community neurologist tends to have a different awareness around efficacy and side effect profiles of meds on the market. And as a result, they might only prescribe what they're comfortable with. So the society is working to address those knowledge gaps among community neurologists, and we would love to find additional partners for that work, including those partners who might have technology or tools that might provide some of the answers. To sort of paraphrase what I've already discussed, if I had to describe a more perfect process, it would be streamlined. It would significantly lessen the burden on the patient. The patient would have a lot of choice, everything from choice of provider to being able to pick where they get their medication. Ideally, there would be shared decision-making of picking the med. And as we have discussed, the patient needs full understanding of utilization management requirements and out-of-pocket costs at every point in the process. And finally, I think I'd love to point out, as always, that we hope our partners are truly considering and putting the patient experience at the forefront when designing solutions and technology. And we would love to work with any and all of you to make that happen. Thank you so much for your time and for the important work all of you do. And I'm going to pass it back to Dr. Andrew Mellin.
Thank you, Steffany. Thank you for both sharing your personal story, being the voice of and supporting the nearly 1 million patients in the United States with MS. There's something you said that's going to stick with me for a long time: precious personal resources. You're a person living with a chronic disease. If you are a navigator supporting that person with a chronic disease, you don't want to be spending your precious personal resources playing ping pong, as you described it, not knowing where to go, taking wrong turns, hitting dead ends on that map. But instead, you just want to use those precious personal resources to helping yourself, helping your family live the best quality of life possible with the disease that you're managing. So I think all of us should keep that in mind, those precious personal resources for that patient, for the navigator, even for all the individuals supporting that patient, in pharmacies and provider offices and elsewhere. How do we use those personal resources towards healing, towards wellness, towards living the quality of life that's most meaningful to that person? So I'd love to hear your voice a little bit on how we can address these challenges. We are going to bring up a poll. So there's two ways to do it. You should see a link right now that's pollev.com/specialty2021, or you can just text specialty21 to 22333. And so we'll take a few moments here and like to hear your voice. In order to prevent gaps in care, which challenges are the most important to address? All right, we'll do this for a few more seconds here. And I think there's a pretty overwhelming winner, medication affordability. We certainly heard about that in Steffany's talk. And again, I think it's on all of us to think about how can we help our patients better afford and understand the options for affording those medications. So now we're going to take a brief break. We'll take a break till 11:50 Eastern time. So 11:50 Eastern time, we'll reconvene. When you come back, don't stay on the same page you're at right now. Go back a button, use your back button to go back to where you started, or use the original link, and you'll click on the next session to get started. So thank you, and we'll be talking again shortly.